Hi everybody, welcome back to I Care for Your Brain with board certified neuropsychologist Dr. Karen Sullivan. That is me. Please make sure you don't miss out on any future free brain health lectures by becoming a subscriber here on the YouTube page or following us on Facebook. We are here because we are both committed to one goal, and that goal is brain health. We all are motivated by different reasons for wanting to educate ourselves with science-based brain health information. My job as a neuropsychologist is to inform you of the information that I would give my patients in my practice every day. And a big part of my recommendations have to do with reading large volumes of scientific research, distilling it down into understandable language, and what I love the most, which is behavior change. Those are action steps that are informed by science, where I instruct you on some very specific things you can do to improve the health of your brain. And what we're going to talk about tonight is really the most basic, the most foundational recommendation that it is I give my patient. And this was inspired by a study that was recently published. This is probably the most common thing. If you were to come into my practice, this is something you would hear from me no matter what it is you came to see me for. And it all comes down to one word, and that word is to engage. We could also use the word effort, okay? So what I mean by this is really the modern approach to brain health. It is not one thing, it is not two things, it is not three things, it is all the things, okay? And all the things, doing all the right things for your brain health really takes effort and engagement. So up until now, scientists have really looked at singular interventions for brain health. So what I mean by that is we really do have a pretty good idea of a brain healthy diet. We understand how exercise transforms our brain with increased nerve factor growth. We understand that we can reduce our instances of getting vascular dementia, Alzheimer's dementia by looking at different impact of health factors like hypertension, diabetes. What we do in science is we aim to control very specific variables until we can group them all together and look at them in one healthy grouping together. So it was a necessary starting point that we had to look at these interventions just on their own, but we are really ready to turn the page. And the real modern way that we think about brain health, like I said, is it takes multiple interventions. So eating that brain healthy anti-inflammatory diet, we know that there are very clear benefits there. We also know, as I said, exercise is great for the brain. We know that when you are depressed and it's not treated, you're going to have some negative impact on brain health. Being a social butterfly is great, but all of these things individually only get you so far, and they are not giving you the biggest benefit, the biggest bang for your buck. Each one of these interventions gives you one layer of health, but what we now know is you actually need to be doing all the things simultaneously, okay? So numerous benefits can stack up when we do little things, but because the complexity of the brain and the complexity of who we are as human beings is so significant, we actually know that we need efforts from each bucket. But that effort and that engagement is brain-based, right? So often we think of things like how motivated someone is to exercise or to eat right. We often lump those things into character, and it's not true. It's a brain-based behavior. So what I want to do tonight is tell you a little bit about some research studies that I think are very exciting, and then we're going to talk about that brain basis of motivation and how it is that you can try to work with your brain better for its own benefit. So I'm going to tell you about the research first. This is called the FINGER study, and this is out of Finland. So FINGER stands for Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability. And they did exactly what I've been talking about today. What they call it is combination therapy. So what that means is they had a group of about 1,200 healthy older adults look at doing efforts every day for their physical health, for their diet, what they call cognitive stimulation, and then self-monitoring on some heart health related issues. And they had a comparison group, which was healthy older adults that basically just got general medical advice. They were not told anything specific to do with diet, cognitive stimulation, exercise, or vascular health. And this was a double-blind, randomized controlled study. So this is the top tier of what we're looking for in science. And what they did is they followed these people over 2 years, and they looked, the endpoint was their cognitive test performances. And what they found is in the group that did all the things, all the interventions bundled together, they were able to have their overall cognition improved by about 25%. Now that is very powerful in the world of brain health interventions. We often don't see power that significant. So when they looked a little bit closer at what were those cognitive improvements, they saw them specifically in executive function, which is part of cognitive abilities that we use our prefrontal cortex for. So this is like planning, organization, multitasking. We also saw that people's processing speed improved, their ability to find their words and put details of a problem together. And we also saw that memory improved. Okay, so what was so wonderful about this is that they did do these multiple interventions and they were able to see a bigger benefit. So of course, it's showing us that there is a cumulative impact on these interventions. We also saw that people who followed the combination therapy were able to reduce the risk of developing all new chronic diseases. So this goes for type 2 diabetes, hypertension, and high cholesterol. They also reduced their risk of functional decline. So what that means is they were able to stay independent longer in the community and in their home. And they also rated their health quality of life as higher. So they felt more confident in terms of the efforts that they were making. They also looked at people who were the most genetically susceptible for Alzheimer's disease by looking at the ApoE carrier marking. So we have 4 different options for our ApoE genes, and there's very specific ones that significantly increase our risk of having Alzheimer's disease over our lifetime. And what they found was that those people specifically showed a very powerful benefit. So what that means is for those of us with a family history of Alzheimer's, we should really be taking these science-based interventions a little bit more serious. So the underlying impact of this study is that by treating multiple risk factors for dementia at one time, we get the biggest result, the most significant brain health impact that we can see over the course of time. So what's awesome about this study, it was done not so long ago, and we've seen repeat versions of this study now in about a dozen designs. So what this tells me is this is the wave of the future for brain health. Brain health is whole person health. Whole person health is brain health. It's really not appropriate to be thinking of brain health as something that exists separately from your social health, your diet and exercise, your cognitive stimulation, right? Is a commitment that we make to care for all of ourselves, mental, cognitive, physical, social, spiritual, even financial, right? Anything that can potentially be stressful, that can lead us to having unhealthy habits in everyday life. These things are bad for brain health. In most instances, brain health is cumulative. It is incremental. What we do at 15 years old ultimately catches up with our brain when we're 80. Ultimately, when we're 40, if we aren't taking good care of our vascular health, our ability to have good circulation and get out there and increase the health of our blood vessels, we're ultimately going to have problems with our brain health when we're in our 70s. So I want us to think a little bit more about this core recommendation to engage, right? Engage suggests a certain amount of agency, a certain amount of initiative, a certain amount of action. When we are engaged, we are making things happen. And this is in contrast to being passive, which is letting life happen to you, right? Engagement happens in big and small sizes. What I'm really asking you to consider is to just engage a little bit more today than you did yesterday. We don't always need to be engaged. We don't always need to be doing something. There are certainly times in life that call for stillness, for some degree of passivity. And we know that there's therapeutic benefits to mindfulness, to meditation. But it is still an engaged mindset that seeks out those experiences, right? Passive, the real danger is kind of the whatever, I don't care attitude towards life, right? In past lectures, I've talked about the cumulative impact of health choices in kind of a negative way, meaning when you don't do certain things, ultimately you're going to have some type of cognitive disorder or some type of brain health challenge. So great example of this would be your vascular health, right? So if you have trouble with blood sugar regulation or maintaining good blood pressure in your 40s and 50s, like I said, by the time you're in your 70s or 80s, it definitely catches up with you. You're much more likely to have vascular related cognitive impairment, including stroke. So what I want to do in the new year is kind of balance out some of those little bit more negative messages with things that are positive, actually telling you what are the things to do. I don't always want to be on here telling you the things not to do. So how can you be more engaged? Well, for me, I really believe it starts with education. So watching these videos, understanding brain health from more of a scientific perspective, not from someone who is trying to sell you pills or a game that's going to promote brain health, but really looking at the full body of decades of scientific literature and having someone distill those core messages down and give you direction, I think, is the most important way to engage, because then you actually get that return on investment. You know what it is you're supposed to be doing. I think boiling it down to that simple word of engage is helpful. So when we look at what keeps people motivated, what we see is there's a couple different strategies. So one of them is what we call metacognitive strategies. So this is getting more clear on why it is we do the things we do. And this is actually a very personal question. This is not something that your spouse can answer for you. This is not something that your doctor can answer for you. This is, what is your why? Why bother? Why put in the effort? Okay, why do you want to feel better? Do you want to be more independent? Do you want to connect more with the world? Do you want to return to your favorite hobby? Do you want to be able to travel more to your favorite place? The more specific you can make this why, the more likely you are to engage with the behaviors that are going to keep your brain healthy, okay? What I don't want to do as a neuropsychologist is presume that engaging is easy for those of you who are listening to me, because as I said in the beginning, motivation is something that we often attribute to character, when the truth is it's really a brain-based behavior, okay? So we have a motivation network in our brain. This is focused in the amygdala and the prefrontal cortex. The brain circuitry in this area is really driven by two goals, which are reward and punishment. The reward system uses the neurotransmitter dopamine to communicate its messages. Dopamine responses really vary between two different people. Some people are more hardwired to do things when they get a reward, and other people are more hardwired to do things when they're trying to avoid a punishment. So one thing for you is to think about what really motivates you, what lights that fire under your butt that's going to get you to do the thing you know is good for you, okay? After a brain health challenge of so many different kinds, you know, there's some very unique symptoms people have, but there's also some very common symptoms. I would say that trouble with motivation is extremely common in our community of people living with a brain health challenge. And what this really feels like, I think, is trouble starting a task. You cognitively want to do it, you have goals and interests, but the turning the key over in the ignition, the actual starting of the process is very difficult. And there is a name for this in brain science called ademia. So what this means is basically difficulty with the doing, right? So you have the motivation, you kind of have the interest, but it's the actual doing. The closest we see in psychology to this, as opposed to a brain health challenge, is depression. That's why so many people who have a brain health issue get misunderstood as having depression, and people with depression often wonder, gosh, maybe that bump on the head I had years ago really did do something to me, because there's so much overlap. And what's really important is to get an assessment for yourself to figure out what is the reason you're really struggling with motivation. But there are a few tips that I can give you that will work for almost everyone. The most important thing is to not get overwhelmed and to remember that you have have to break tasks down into small but realistic goals. So if we look to the field of neurorehabilitation, where they actually work with people who have had recent brain injuries, we know that the approach they use in rehab is called setting SMART goals. So the S stands for specific, the M stands for measurable, the A stands for achievable, the R stands for realistic, and the T stands for time bound. So any goal that you have to make sure you're very clear on exactly what it is you want to do. You have to be able to measure it. So that's where, Fitbits can come in. I want to do 2,000 steps a day. I want to do 5,000 steps a day. It has to be achievable. You have to be able to walk. It can't be unrealistic. It has to be relevant, which I think really means it has to fit into your value system, right? It has to be relevant to you. It can't be me as your doctor telling you, I think you should do this because, I want you to reduce your risk of falls. It has to be something that's important to you. And it has to be time bound, which means it can't just be kind of willy-nilly, in the future, I'm going to exercise more. You want to say, tomorrow, I'm going to increase my steps by 1,000, right? Once you have that SMART goal, you actually have to give yourself a daily prompt in order to follow through with it. So often we see people putting Post-it notes around the house. You could set an alarm on your phone. You can draw in a family member or a friend to give you some accountability and to prompt you. Or if you really want to play into the motivational system, that reward punishment reinforcement, you can use that to your benefit. Okay, so if you're someone who you deep down know you're more motivated by the reward, you have to find something healthy and wellness related to do good for yourself if you do X. Maybe you're someone who's actually more motivated by something bad's going to happen. So you can either take something away that is pleasurable to you, or you can think about, what not good thing is going to happen. But what I want you to be is gentle with yourself. We don't want to get into kind of a punitive, harsh way of interacting. We want to make choices and be engaged as opposed to just passively letting life pass us by. Sometimes we need to kickstart engagement when we are in the brain health community and just start small. Something like just getting in the shower, turning on music, calling someone and asking for help. We don't want to really think too big. Remember, with those SMART goals, we're really trying to make them very specific and finite. We don't want to overwhelm the brain by having 18 things to do in one day. And if we don't do them, then it's going to be a failure, right? We want to keep things very, very finite and specific. Neurofatigue is also a challenge for many of you listening to me right now. And this is probably the most poorly understood symptom of having a variety of things not working well in your brain. You can't test for neurofatigue, even though I might ask you questions about it. I'm not in your brain. I'm not in your body as a neuropsychologist. It is really something that falls under the invisible disability symptom. And those are tremendously difficult because other people don't get it. If you're too tired, it's very hard to put your interests into action. So I have a lecture here on social media about neurofatigue that I encourage you to watch if you haven't already. What we want to make sure, though, is that we're doing the basics, right? We are hydrated enough, we have eaten enough protein, we're avoiding simple carbs and sugars, we're making sure we're getting enough good quality sleep in terms of both length and quality, right? We want to make sure we have as many continuous hours under our belt as possible. We also want to consider, this is kind of at the further end of interventions with neurofatigue, is talking with your doctor about a stimulant. Many of my patients have benefited from using something like Adderall or Ritalin or Concerta. They're really not just reserved for children who have attention deficit issues. Many people in the brain health community find a lot of help with motivation and initiative by safely using stimulants as their doctors prescribe. So that could be something to talk about. I also want you to be flexible in the way you approach this to-do list, right? Just because you can't do something like you did in the past doesn't mean that you have to give it up completely. I want you to try to do it as much as you can. This is important for a few reasons. Psychologically, it will help you feel like yourself again, okay? We also have neural networks that are built in our brain over years and years of building expertise and interest in our hobbies and the things that we've done for work and the things that we've studied in school. When you go back to doing one of those activities, you're basically getting the benefit of all those years of an investment, okay? Even if you cannot physically participate in your hobbies anymore, what science would tell us is even just watching or listening will also activate what we call mirror neurons in our brain to basically mimic that exercise or activity in our brain. So, if you used to love to play tennis, but you can't do it anymore, simply watching a tennis match on TV, probably even listening to the ball going back and forth, will actually activate that neural network and you will get some degree of cognitive stimulation. So you really want to fall back on things that you've done many, many times in your life. To help you engage more, we have created a downloadable graphic for you to print out, and I want you to put it in a space that you are going to see every day, a well-trafficked area in your home. It's going to be linked to in the comments, and I would love for you to print it out and incorporate it into your everyday life. So the most common recommendation that I give to my patients is simply to engage in all the things. Don't put all of your eggs into one brain health basket. Remember that true brain health comes from doing a little bit of the good stuff in a variety of areas. Thank you so much for listening to me today. I would be so appreciative if you would share this lecture with somebody you know online. Leave me a comment. Let me know what it is you think we could do more of here in terms of topics, and I look forward to seeing you next time. Take care. Bye-bye.